Hello, my name is Don BOSCO, founder and CEO at BHuman.ai, and we enable you to actually clone yourself in video. We do so by cloning your face and cloning your voice so that you can scale yourself in communication. And we work in dozens of industries, but today I want to focus on our work in healthcare and how we're solving some really serious and core challenges in healthcare. And this has the effect actually on quite a few lives. So we're going to get into it. So the first thing is that healthcare has a communication problem. And this is a really core root issue that is manifested in really dozens of problems that we're trying to tackle in healthcare today. And so if you start by looking at the average patient experience, right, you'll notice that a patient only spends a very small amount of time in the office with their practitioner in person, right? A large part of the patient experience is spent going back and forth over phone, email, even letters in the mail, right? And that's because with such a large patient population, right, how can healthcare groups communicate with patients? And you don't want to take time away from doctors and nurses to do that, right? So they resort to these sort of mass notification systems. But these are decade-old systems and they haven't changed in, literally 20, 30 years. And such communication can easily be overlooked and ignored. I mean, I'm sure that we all have probably hundreds, if not thousands, of emails we haven't opened in our inboxes. And one of those could be from a healthcare group, right? Trying to get in touch with us. And that's just the reality we live in when consumers are so overloaded with information and advertisements in today's world. And so we're basically taught, how to filter out these sort of mass notification systems. And as a result, Avtex reports that about 70% of patients say that their healthcare providers need to improve how they interact with patients. But this is much more than just ease of communication. This actually has a serious effect on human lives. So if you look at it, in a 12-year period in the US, about 70,000 people experienced serious medical outcomes as a result of facility medication errors, right? And this is not in a doctor's office. This is taking medication at home. And this is actually sadly an upward trend, and the number of cases nearly doubled between a 13-year period. And the reason for this is because, again, the lack of communication that's happening. And there's so much more that goes into this beyond just, okay, I forgot to take my medication on Wednesday like the doctor prescribed, or I took 2 pills instead of 1, right? Communication has another issue, which is no-shows. So studies show that in the US, no-show rates for doctor and hospital appointments are as high as 30%. And this is costing the US healthcare system about $150 billion a year. And what's more serious, perhaps, is the kind of people who don't show up to their appointments are more likely not to return within the next 18 months. And these are kinds of patients who are typically older, who have chronic conditions, who actually need care the most and need that attention the most. And if you look at it, again, this is a manifestation of that communication problem. Because if we were able to somehow communicate in a human and direct, personable way that, hey, Frank, your appointment is tomorrow at 3 p.m., don't miss it, right? We would be able to mitigate this issue. And there's a lot of other manifestations of this problem, such as degrading trust in healthcare and medicine. And we saw this with the most recent COVID vaccine, right? There's a lack of trust between patients, between the population, and healthcare groups in medicine as a whole. And that rift is only widening as time goes on. Hospital and healthcare group systems are very complex and depends on where you are, right? In the US, it depends on what state you're in, right? Let alone what country you're in. We also have the inability to actively go out and go to the community and encourage prevention, encourage healthy habits, and encourage prevention screening in order to catch diseases before they develop. About 70% of US patients aren't motivated to go out and get a second opinion, and that might be just because of how difficult and how unsatisfying the whole healthcare experience is today. There's the whole concept of misunderstanding prescriptions, forgetting to take medicine, or taking too much, which we talked about in the last slide, leading to quite a few serious medical outcomes or deaths. And finally, the whole appointment issue, right? And people falling out of the healthcare system. So what can we do about that? How can we use AI to solve this very, very serious core problem of healthcare? And we're tackling that problem exactly. And we do so using our patent pending AI. So what we do is we actually clone your face and voice. And this can be of a doctor, it could be of an actor, an administrator. And we actually change what they say in order to create personalized video messages that look and feel 100% real. And these messages can then be embedded throughout that patient experience in ways that humans could never scale themselves. But when people receive these messages, right, they feel that they're actually being talked to by a real human being. And so they're much more likely to take action and take that message seriously. And this is not some cold email or some phone call from a robot that people ignore, right? This is a serious video that looks completely real. And so I want to show you, before we get further into how this is changing the way communication is done in healthcare, I want to show you a couple examples you can really see for yourself how it looks. So the first use case I want to discuss with you is test results. So imagine a patient does a test and the results are not ready a couple days later, and we want to notify them about that. So we could have used an email, or let's use video and let's see what that looks like. So in this case, it's coming from a doctor. So let's say this is going to someone named Aria.
Hi, Aria. I'm getting in touch from Richmond Hospital. I wanted to let you know that we've just received the results for your recent test. You can view the results by clicking on the link in this email and logging into the patient portal. If you have any questions, I'd be happy to walk you through the results and what they mean for you. So feel free to schedule a time on the patient portal so we can do that together. Looking forward to speaking again soon. Stay well.
All right. Now, if this was going to someone named George, let's say, he will get this video.
Hi, George. I'm getting in touch from Richmond Hospital. I wanted to let you know that we've just received the results for your recent test.
So you can see the main message here is the same, right? But we're actually personalizing the key parts that matter. So in this case, it's just the first name, but we could have easily personalized much more. Could have personalized, hello, first name. I wanted to let you know that, today is Wednesday, so it's time to take your medication. Take 2 pills of this medication and 1 pill of that medication, and all that would be personalized and can be done at scale automatically using our artificial intelligence. And I want to show you another example, which revolves more around outreach to community and preventative care. So let's say this is going to someone named Elisa.
Hi, Elisa. I'm Dr. Sienna, and I want to know, when was the last time you enjoyed going to the doctor's office? Too many times it is inconvenient, slow, confusing, and you don't know what it is going to cost. But my team and I are here to fix that. We offer a service that makes your healthcare fit around your life, and it's affordable, effective, and a really important option for family members who need to have a coordinated experience while facing disease. So let a doctor that you know become a part of your trusted network of resources. So please.
Okay. So I think you get the idea, right? We're able to take a base recording, clone that face, clone that voice, and then change what they're saying so that we can have effective communication with patients. And this can really be used throughout the whole patient experience journey, right? We call this the healthy patient experience map. And what does healthy patient experience look like, and how can it be supercharged and made more effective with AI and AI video in particular? Right. And the first thing I would say is it starts with proactive outreach, starts with going into communities, talking to people on a one-to-one personal level directly using AI video, and letting them know, hey, here are the different things that you can do to maintain a healthy, active lifestyle. Are you exercising? Are you eating right? What does eating right look like, right? And have those communications at scale that we try to outsource, right, to perhaps schools and things like that, that is so often not effective. You can identify signal points, right? So you can look at a patient, or a potential patient rather, and identify, all right, here's a couple of signals that show this person is not doing well, or shows that they potentially could develop disease in the future. We have something called recommendation engine. Recommendation engine basically takes a bunch of inputs from a user. So a patient could go on and they could answer a couple questions about their lifestyle, maybe about a pain they're having, something they're experiencing, and then get a recommendation back. And this is using artificial intelligence to decide what is this patient experiencing, what their problem is, and what are a couple of potential solutions we can recommend to them. And almost always this is, okay, come into the office, let's get you checked out. But providing that input and response is really important because it makes a patient feel that they're actually listened to. And we provide that response in the form of AI video. So it looks like someone is actually looking at their case, deciding what could be going wrong, and then giving them a response. And as a result, people feel listened to and valued and cared for. We can encourage preventative visits. We can tell people, hey, you know, Maria, come in and see me. I want to do a checkup. It's been 6 months since your last checkup, so you're overdue. Let's make sure everything's okay, and personalize that whole experience. Provide education. You can do appointment booking as well. Again, appointment reminders, which is very important. Digital follow-ups. So we know that following up on a certain case is very, so we know that, I'm going to redo this part here. So digital follow-ups, we know that following up on a certain visit is a huge part of the healthcare experience. And in fact, I'd say most of the healthcare experience for the average patient is doing follow-ups, right? And so you can receive those follow-ups in the form of video messages to show someone is actually caring and looking at this. The other thing I would say is that, you know, if we want people to trust medicine and you know, pharmaceutical industry and healthcare as a whole, right, that requires trust, and that requires a relationship. And so we need to build an ongoing relationship. And the only way to do that is at scale is with AI, and particularly, I would argue, AI video. Medication check-ins, which we touched upon, and then repeated visits over time, right, inviting someone to come in for check-ins and checkups as time goes on. And then within the whole healthcare community of employees, right, we can do training, we can do recruiting, we can do goodwill and relations with researchers and doctors in the field. Again, a couple of use cases. We have billing and finance, staff training, patient portals, community outreach, grateful patient donation programs. Really, creativity is the limit here, right? So there's so many ways to apply this, so many ways to make the healthcare system more effective and save lives. And so one really key statistic for me that stands out is that 30% of all healthcare costs could have been saved with prevention. This is from the National Academy of Medicine, right? And so prevention really is the best medicine. And if we can go out and if we can actually find those things, those diseases before we develop, and then talk to those patients at scale, right, we can not only save money, but save lives. So how do people respond to these sort of AI videos? And so at BHuman, we've done work in dozens of industries, ranging from sales to healthcare to politics to utility companies to some healthcare groups. And we see that the results are always the same and very powerful, right? So for some communication metrics, we see that when using AI videos compared to traditional text-based communication, open rates more than double, about 124% increase on average for open rates. We see that click-through rates increases about 600%. So this is the rate of people who open a message and actually click onto a link, whether that's to watch the video or to fill out a form. And conversions increase about 300%. So these are average numbers we're seeing across a variety of industries. And you know, the result is always the same. People always reply to these videos really enthusiastic and just surprised and taken back that somebody took the time to actually, you know, take their phone out, take their camera out, and talk directly to them. And so across the board, we're seeing really appreciation and reception to these kinds of video messages. So we're showing that this path to a new communication is really the way to go, and it's the way of the future with artificial intelligence. And so I want to end this with a couple of different benefits of how AI video can benefit everybody, right? From patients to healthcare groups, you know, all stakeholders. So I'd say for patients, this sort of novel approach grabs attention, right? You're not receiving a personalized video every day. So when you do get one, you're going to pay attention. And most importantly, it builds a human connection. And so we're building that relationship and therefore building that trust that has been degraded in the past few years. We're offering a value proposition that's relevant, right? So we're talking about that patient's particular problem, that patient's particular disease. This is not some sort of generic messaging. And we're explaining a complicated concept perfectly every time, right? If we're talking to a patient about diabetes, we can explain what diabetes is in a way that is the most tactful, most accurate, best precise way to do so, and then scale that across millions of people who are experiencing diabetes, right? We don't have to have one person explain diabetes in a subpar way and then do that, you know, a bunch of times. So that's the benefit of cloning yourself and cloning speech. And for compliance, actually, we've seen a lot of benefits here. So especially when it comes to healthcare. Compliance is a very serious and important thing. And using AI video, we're able to clone speech, right? So we're not saying something that hasn't been said before. Everything is very pre-planned. So therefore, it's legally compliant. We can make sure that all the speech that is being communicated to patients is on brand with that hospital group or healthcare group, and isn't going to get anybody in trouble. It's always delivered with the right tone and manner. The speaker can be customized based on the target audience. So, here in the US, we have a large Spanish-speaking population. And so, send them messages in Spanish, right? Send them messages that are going to be most relevant to them. Or you can change who's actually talking. So, perhaps in some cases, a doctor might be the best person. Perhaps an administrator might be the best person, or a nurse or a specialist. So we can change who's talking to patients based on what's going to resonate the most. Finally, when it comes to patient data and security, this sort of solution is fully HIPAA compliant. All data is de-identified and encrypted, so we don't have to worry about anything on that side as well. And I'd say most importantly, right, doctors are not administrators, and I think that our healthcare system has relied too much on doctors to be administrators, to be cogs in the bureaucratic healthcare machine that we've engineered today. And we need to get back to letting doctors do what doctors do best, which is taking care of patients. And so we need to use artificial intelligence to automate and optimize everything else around that, the doctor's responsibilities that is not taking care of patients. So in this sense, I think that AI can actually make the world more human, because we don't have to do these sort of, repetitive tasks, and we can focus on the things that we've been trained to do. We can save lives, prevent disease, and rebuild trust between patients and healthcare. And so that is my presentation. Again, my name is Don BOSCO, founder here at BHuman.ai. We are the only platform out there that is really pushing this to a level where we are able to clone someone in a believable way that looks and feels completely real. So if you have any questions, you can always contact me, Don at BHuman.ai, and thank you very much for your time.